What treatments are available for genitourinary system conditions? Have you ever wondered what options exist for treating conditions of the genitourinary system? This system includes organs that produce and eliminate urine, as well as reproductive organs. The treatments can vary widely based on the specific condition, especially when it comes to bladder health and bladder cancer. For bladder cancer, one of the key treatments is intravesical therapy. This is a localized approach where medication is delivered directly into the bladder using a catheter. A notable advancement in this area is the FDA-approved mitomycin intravesical solution, known as Cystitis. This treatment is specifically designed for recurrent low-grade, intermediate-risk non-muscle invasive bladder cancer. It uses a hydrogel-based formulation that allows the medication to remain in the bladder longer, enhancing its effectiveness. Interestingly, there is also a home-based installation option. Traditionally, intravesical therapies were given in clinics, but studies show that trained healthcare professionals can safely administer mitomycin treatments at home. This can ease the burden on patients and healthcare systems while ensuring safety and efficacy. For more advanced cases of bladder cancer, surgical options may be necessary. These can include transurethral resection of bladder tumor, partial or radical cystectomy, which involves the removal of part or all of the bladder, and reconstructive surgeries. In cases of muscle-invasive or metastatic bladder cancer, systemic therapies such as chemotherapy, immunotherapy, or targeted therapies may be utilized. Now, let's talk about urinary tract infections, commonly known as UTIs. These infections affecting the bladder or other parts of the urinary tract are typically treated with antibiotics. Recent FDA approvals include new antibiotics like gepotidacin, which can be taken orally over several days for uncomplicated UTIs. The choice of antibiotics and treatment duration often depend on the severity of the infection and individual patient factors. Other genitourinary conditions include benign prostatic hyperplasia, or BPH. Treatment options for BPH can range from medications that relax prostate muscles or shrink the prostate to minimally invasive procedures or surgery. For conditions like interstitial cystitis and overactive bladder, management may involve lifestyle changes, bladder training, medications, and sometimes nerve stimulation therapies. It is essential to remember that treatment plans should be personalized based on the patient's specific condition, overall health, and preferences. Regular monitoring and follow-up are crucial, especially in cases of bladder cancer, to detect any recurrences or progression. Always consult qualified healthcare professionals to determine the most appropriate treatments for any genitourinary condition. With advances in treatment options, patients can find effective ways to manage their conditions, but professional guidance is key to ensuring safety and effectiveness.